Hey, so pregnancy, stress, and iron. Man, I love it when you think you see a patient, they got an issue, and you're like, wow, I wonder if somebody's done any studies on this. And you go look and you find, whoa, they've been doing studies. Even just as recently as this last summer, they've been doing studies. So this particular study was looking at pregnant women and effects of stress and how that would affect iron metabolism. In pregnant women, you need an average of 30 milligrams of elemental iron every single day. Is that wild? This is 2 times what their body would need if they were not pregnant. In fact, some women need 8 times the amount of iron during their second and third trimester compared to their first trimester and when they're not pregnant. That's a lot of iron, right? And this is to meet the new demands of extra blood volume, the growing baby, and the placenta. Because the placenta needs iron, baby needs iron, mama needs iron. In prenatal vitamins, they can rarely make up for these needs, as there's too many minerals, too much calcium in those prenatals, and they're all basically going and competing for the same absorptive pathway. Or it may be the form of iron that the prenatal has that it's just not well utilized. In developed countries, in affluent countries, United States, still 50% of women are iron deficient. Isn't that wild? We think about third world countries, malnutrition, but no, 50% of people in the United States of America, Europe, these developed nations are actually iron deficient. Sorry, I shouldn't say people, but pregnant women are iron deficient. And iron deficiency in pregnancy can cause low birth weight, can cause effects on neurological development of the growing baby. And these effects, they don't necessarily just stay there. Those neurological effects, they can keep going on and affect the baby way downstream. So stress has been shown to affect the developing baby and increase the potential for ADHD, for autism, and neurodegenerative disorders like Alzheimer's disease, dementia, Parkinson's disease. And those are hardcore disorders, right? And you think, wow, well, that's like 50, 60, 70, 80, that's way down the road. But this is a fact, according to Dr. Martin Frasch, the professor of obstetrics and gynecology at the University of Washington School of Medicine. Pretty good school, right? So iron homeostasis in the baby relates to the mother's experience of chronic stress during pregnancy, bottom line. And this has been shown to be even more apparent or prevalent in male babies compared to female babies. So maybe that's why more males have ADHD and that kind of thing, or more males get Alzheimer's, more males get dementia. Hard to say for sure. When a woman experiences chronic stress, especially in the third trimester of pregnancy, the ability of the baby to absorb iron can be compromised. And this compromising, can be like 15% decrease in the ability to uptake iron by the baby. Is that wild? Just from chronic stress. So making sure iron levels are sufficient, and that if there are chronic stressors, we really work to manage them efficiently. That can be a powerful means of promoting pre and post natal brain development and making sure that this baby, this child, flourishes in the nervous system. So think about doing a meditation, exercise regularly, breathing techniques, prayer, make sure you have supportive relationships, even eating nourishing food so you're not stressing your body by the food you're putting in, taking time for rest. All these can be insanely valuable, powerful tools, in reducing one's experience of stress, because stress isn't going to go away, but our experience of it decides on how it's going to affect our body and the baby. So be sure to get your iron levels checked, get your ferritin levels checked, and make sure they're optimal. Even if, they were normal in your first trimester or before you got pregnant, that increase in blood volume and that increased need, that could completely change that in the second and third trimester. And if you want to look into, more details of this study, you can check out the July issue of Scientific Reports. for a good write up on it, and all the ins and outs of what these docs found. All right, hope this is helpful. I'm Dr. Matt. Send this to your pregnant ladies or anybody that's iron deficient. Help them understand, man. This is high value, and an easy remedy is available if this is an issue for a pregnant woman. Talk to you guys later.